Good morning, everybody. Being the last day of winter, I can safely say that we're looking forward to a better spring than we did winter. And I'm pleased to report, however, that 67% of our adult population officially ticked over yesterday have received their first dose of vaccine. So it's really pleasing to know that officially we were 66-point-something% yesterday. 2/3 of our adult population is now vaccinated, and obviously we want to get to that magic 70% and 80% as quickly as possible. So can I please encourage everybody who's not yet made plans for vaccination to really consider September the month when them and their loved ones, your loved ones and your family are vaccinated. It's so critical for all of us to have a more hopeful spring by making sure we get those vaccination rates up. To 8 p.m. last night, we had 1,164 cases of COVID. 3 people lost their lives, and we extend our deepest condolences to their loved ones. A female in her 50s who did have underlying health conditions, a male in his 80s and a male in his 90s. And again, we extend our deepest condolences to the loved ones of those 3 people. Again, I wanted to stress the importance of vaccination, and we're looking forward in this week, perhaps we get to the 7 million, or at least 70% first dose vaccination in New South Wales would be amazing, because once we know that you've signed up to your first dose, you'll be getting your second dose. And what we want to see then, and Dr Chant and the Minister and I were just discussing this earlier, is once we see first doses get to 80%, we know that we'll be able to reach that target. And it's so critical for us, because whilst 70% will give those of us that are vaccinated, 70% double dose gives those of us vaccinated freedoms, 80% double dose allows us to look at international travel, welcoming home all Australians. How wonderful would it be to welcome back all Aussies who want to be reunited with their families by Christmas? And New South Wales will step up to support that cause and that case. And I really stress to everybody the importance of vaccination. So please think about our community, think about your own loved ones, and think about where we can move forward together as a society. And today we're really pleased to have with us Nurse Michelle Dowd. Michelle is an intensive care nurse unit manager at Liverpool Hospital. She's going to speak to us about what it's like being a nurse in intensive care with COVID patients coming in one of our hotspot areas. But I wanted to take the opportunity through Michelle to acknowledge all of our nurses across the network, across New South Wales. Nurses have stepped up, and whether they've been trained to work in ICU or whether they're supporting us in our vaccinations, and often they're the ones holding the hands of COVID patients when relatives unfortunately aren't allowed to visit them. So I can't thank enough our nurses across the state. Please know you're deeply appreciated, and we know that we'll be asking you to do more in September and October, but we also know this is the training that you've received and that you're up for the task. And I just want to say that we're thinking of you every day, appreciating the stresses you're under, but also deeply grateful for the wonderful work you're doing to support those most in need. So Dr Chant will now give the health update. The Deputy Premier will speak about regional New South Wales, and Nurse Michelle Dowd from Liverpool Intensive Care Unit, who's the Nurse Unit Manager, will speak about the role of nurses in a hotspot. Thank you very much.
There were 1,164 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and 4 overseas acquired cases. Again, high rates of testing with 130,027 tests reported at 8 p.m. last night. Thank you. There are currently 871 COVID cases admitted to hospital and 143 people in intensive care, 58 who require ventilation. As the Premier has indicated, sadly we've lost 3 people have lost their lives. A woman in her 50s from southwestern Sydney died at Campbelltown Hospital. A man in his 80s from the City of Sydney died at St Vincent's Hospital, and a man in his 90s from southwestern Sydney died at Campbelltown Hospital. Can I extend my deepest sympathies to those families of their loved ones. There have been 96 COVID-related deaths in New South Wales since the 16th of June 2021. In terms of the suburbs of concern, again I'm urging everyone in these suburbs particularly to come forward for testing. They're Guildford, Merrylands, Auburn, Greenacre, Bankstown, Blacktown and the surrounding suburbs. I can't stress enough how important it is for us to also see the immunisation coverage levels in these LGAs, and particularly the suburbs that I've talked about, rise very quickly. And it's pleasing to see the rise in the vaccination coverage, but I would ask members of those communities to embrace every opportunity they're afforded to have the vaccine. In terms of an outbreak, we are experiencing an outbreak at Parklea Prison. There have been 43 new cases linked to Parklea Correctional Centre to 8 p.m. last night, meaning there are now 75 cases in total. All of the new cases are inmates, meaning there was a total of 74 COVID positive inmates and 1 staff member. The prison is in lockdown, and appropriate public health action is occurring. There's vaccination going into the prison, there is infection control, practitioners on site, there is clinical care being provided to all the prisoners through a virtual model supported by St Vincent's Health. So just wanted to indicate we are experiencing outbreak in prisons. I've identified previously that prisons are vulnerable settings, and it's been pleasing that we have been progressively rolling out vaccination to our corrective services staff and our prisoners, and we'll redouble our efforts to continue to keep our prisoners and corrective services staff safe. Thank you.
Good morning. I start by offering my condolences to those families that lost loved ones, and you remain in our thoughts and prayers. Again, our concern is Western New South Wales. Overnight there were 54 cases. 32 of those cases were in Dubbo. Wellington and Bathurst both had 5 cases. In Burke, 8 cases. Narromine, Mudgee, Brewarrina and Parkes all had a case in each of those communities. We are concerned. In the far west, 4 cases again, and they all were in Wilcannia. The Hunter New England Local Health District, again 2 cases, this time in Lake Macquarie Local Government Area and the Port Stephens Local Government Area. In the Illawarra, we have 4 cases in Wollongong and 1 case in Shoalhaven. On the Central Coast, concerns again around the 4 cases on the Central Coast, and in southern New South Wales we had that case that we reported yesterday in Googong or in Queanbeyan, and nothing more there. I do want to highlight vaccination rates continue to climb in regional and rural New South Wales. We've seen the latest data from the week ending last week. Southern Highlands are seeing 68.5% first doses with a 41.8% second dose. So that's a really good example of regional communities coming forward, and even on the Central Coast, 63.9% first doses and 35.4% double dose. Again, the message to everybody in regional rural New South Wales is to get vaccinated. We are running walk-in clinics right across the regions, so keep an eye out for that. Of course, our health clinics, our pharmacy network, our GP network, all providing the opportunity for vaccination in the regions. It's part of our freedom and, of course, part of our future. Thank you.
Good morning. My name's Michelle Dowd and I'm the Nurse Manager at Intensive Care for Liverpool Hospital. I'm here with you today to share what it's like for intensive care nurses on the front line during this pandemic response, and to encourage you all to please get vaccinated. Intensive care units in our hospitals are where we look after our sickest, most vulnerable patients. We work in a large team of health professionals and support staff to look after the sickest patients in the hospital. These are patients who've been victims of trauma, patients who've had strokes, cardiac arrests, major surgery. To keep everyone safe in our intensive care unit right now, we've essentially divided it so we can keep the COVID and the non-COVID patients separate and protect the most vulnerable. The Delta variant is just that contagious, and that's why vaccination is so very important. Intensive care patients need one-on-one nursing care. They need to be monitored really closely so that we can respond immediately in case they deteriorate. If you or your loved one is in intensive care right now for any reason, you may not be able to have visitors. We know it's really hard at the moment to be separated from your support network, but the amount of virus that's circulating in the community just poses too much risk to our patients. For our COVID ICU patients, they can't have visitors at all. Every day we're communicating with families over the phone and by video call to connect them. In the worst cases, at the end of life, we'll connect a call with the family and we'll hold the patient's hands and we'll provide as much care and comfort and support as we possibly can. We know this is really hard for families. This is really hard for us as well. We normally work really closely with our families at the bedside when we look after our intensive care patients. But looking after COVID patients is not just emotionally hard for intensive care nurses, it's physically really hard work as well. These patients are some of the sickest we've ever seen. They require so much support and monitoring and physical care. We're in layers of PPE, sometimes for hours at a time. This is really physically hard work. While our intensive care units are really busy and stretched at the moment, we do work in a broader New South Wales ICU network, and we can share the load to some degree. But we really need your help to stop the spread and keep people out of hospital and out of intensive care. The Delta variant is so contagious that we have entire family groups in our hospital. In some really tragic circumstances, we've had parents, both parents of young children, so sick that they need to be ventilated in our intensive care unit and separated from their children. Sometimes they don't have extended family to look after these children, or the extended family is so sick that we need to make alternative care arrangements. This virus is literally ripping families apart. Many of our patients with COVID are young, they're normally fit and healthy. They come from a variety of backgrounds, but the one thing that they have in common is that they are mostly all unvaccinated. We'll be with you right through this, but we need you to be with us now. If you haven't booked your vaccine, please go out today and book that vaccination. Follow the health orders. Help us as your frontline healthcare workers to keep patients out of hospital. By getting vaccinated, you don't just protect yourself, you protect your family, your friends, strangers. You will save lives. You'll help us to save lives. So I know that the restrictions are really hard. We all want things to get back to normal, but we have to stay the course. So please, book your vaccination today, work with us, and we will get through this together. Thank you so much.
Ms. Dowd, are you experiencing vaccine regret of patients in ICU who have indicated that they wish they had got the vaccine?
Certainly not something we're going to ask our intensive care patients, but you know, I think when we're reviewing this, when we go back and we talk to people who've recovered, that will certainly be something that they say. But right now we're just really focusing on supporting them through this.
Can you walk us through, in intensive care, obviously you're used to nursing one-on-one. With a COVID patient, how many nurses are looking after one patient, for example, if they're on ECMO or dialysis or ventilated? Does it take more, is it a lot of strain on the nursing staff? And are you working, 7 days a week?
Our care ratios don't change. An ECMO COVID patient requires 2 nurses, an ECMO general ICU patient requires 2 nurses. So those care ratios don't change. We work really closely with ward orderlies. I can't shout out to our ward orderlies enough. A lot of these patients need to be nursed onto their stomachs. That improves ventilation and oxygenation, and that process takes about 6 to 8 people. So we work in a really big team of health professionals, physios, ward orderlies, doctors, nurses as well. So we're all in this together. I've had a lot of nurses deployed to me. We're training theatre nurses and recovery nurses to be ICU nurses. Nurses that I've worked with for the last 30 years are coming back to intensive care. So people really want to help. Health professionals really want to help right now. So we're all working really hard to share the load and to support each other.
So there is a huge call to arms, I guess. In the
Absolutely, there is a call to arms. Yes.
Mr. Hazzard, just in regards to vaccination, we keep hearing that there are vaccinations available at Kidos Bank Arena. I've just been sent a message to someone watching this at the moment, frustrated that they can't book a 16-year-old in. The website is showing no vaccination bookings available at Kidos Bank Arena for 16-year-olds until October.
I'm sorry, I missed the last bit.
The website is showing no vaccination appointments for 16-year-olds until October at Kidos. Would that be accurate? I think you're in a hotspot.
I don't know.
I've got the brochure right here.
Yeah, look, Clinton, what I'll say is this, that I know it's a struggle because I've spoken to quite a few people who would like to have the vaccine. Quite simply, there is not enough Pfizer in New South Wales or anywhere in the 2 major states, that is New South Wales or Victoria, for the people who are now wanting it. We're certainly asking the federal government to try and get us more Pfizer vaccine. But what I would say is, for older patients, for older residents, you can also have AstraZeneca. So if you're 18 or over, have AstraZeneca. I've got personal friends, family members who've had AstraZeneca. Go and have it. AstraZeneca is a very good vaccine. It's saved vast numbers of people right across the world from what is an extremely dangerous virus. This virus is killing people all across the world in great numbers. Go and get vaccinated as fast as you can. I can also say the system here in New South Wales is working as best as it can. As we've just heard from Nurse Michelle, health staff at the front line are just desperate to see us all get vaccinated as quickly as possible, because if we fail to get vaccinated, then we're putting our families at risk, we're putting our community at risk, and we're putting frontline health staff at risk. Sorry. Can I finish? Look, and I just want to say this, that if you are over 16 and you can get the Pfizer, then of course look around. There are various opportunities on the booking systems, but also quite simply you might have to be patient until the federal government can provide more Pfizer to New South Wales and indeed also to Victoria. Sorry, Lucy. Sorry, I'll just do Lucy, Alex, and I'll come back.
Minister Hazzard, how many ICU nurses do we have in New South Wales? And we're hearing lots about, so many members of staff being taken offline because they're becoming close contacts at hospitals. Do we need to source more?
Well, as Michelle just said, since the pandemic started last year, there's been a lot of work done to build staff resources in what is normally an extremely specialised area of medicine. But as Michelle also said, we've seen quite a number of nurses both coming back into the profession, but also those in other parts of the hospital and being trained up to work in ICU. So I think I mentioned yesterday that I know theatre nurses who I've spoken to who've retrained to assist in ICU, and what they've said to me is it actually has brought the whole team together in the hospital. I think I made the reference yesterday to being a bit like an aircraft carrier, and there's somebody who's in the bow or of the ship may not know what's going on in the stern, but now there are quite a number of additional staff who've been trained up to work. So it's a matter of having the expertise, the guidance of someone, of course, like Michelle, and also the equipment. And we've done everything we can here in New South Wales to make sure that's the case.
Is there a count
and we'll continue.
number of ICU?
Look, I can't tell you that at the moment, but I'll try and find out for you, but I don't know the exact answer. Yeah. Sorry, Alex, next, please. Sorry.
Just on that plea for more Pfizer, have you worked out how many more doses you need to satisfy the supply?
A lot. A lot.
Is there a number there?
Look, Pfizer, unfortunately, the mixed messaging that's gone on over the last 6 or 8 months on the vaccines, particularly AstraZeneca, has not been helpful to the broader community's understanding of just how important it is to get vaccinated from any vaccine that you're eligible to get. And as Health Minister here in New South Wales, I'm extremely frustrated about that, and I think that frustration is shared by many of the health staff, the frontline health staff. But at the end of the day, it's a worldwide pandemic. Let's just get real about this. It's a worldwide pandemic. The federal government's doing their damnedest to get the vaccines. And when they get it to us, we'll get it into arms.
Just on ICU,
on the staffing levels, regional nurses are telling me that they're highly anxious about watching what's unfolding in Sydney and not being able to have the staff to cope, that many are leaving the nursing profession and not wanting to deal with an onslaught of cases if they do turn up in a regional community. What's your message to those nurses that are looking to quit?
There might be a small number, but Sarah, I've actually not seen that. In talking to the health staff, I think this pandemic has been a clarion call to nurses who are in the profession, but also nurses who've left the profession to come back and fight this virus. We're at war. And you just heard what Michelle said. There's a real enthusiasm for the entire team to be there fighting the virus. And so if there are some that haven't decided to respond to that, well, that's a matter for them. But I'm quite confident that when I see them, I talk to them every day. New South Wales health staff generally, doesn't matter whether you're the cleaners making sure that the virus is being cleaned out of the hospitals, or whether it's the nurses, or whether it's the doctors, or the front patients serving administrative staff. They're all working their backsides off, putting it bluntly. And that's why we keep saying, give them a fair go, folks. Go and get vaccinated. If not getting vaccinated is actually self-entitled and indulgent in the extreme in the middle of a pandemic. Go and get vaccinated and be fair to the rest of your community.
Mr. Hazzard, just on ICU nurses, thank you. Just on ICU nurses, we're hearing that part of the problem is also that ICU nurses have left to join vaccine clinics and special health accommodation, and they're very skilled staff. So I was curious, are there any plans to maybe recall skilled ICU nurses from vaccine clinics back into ICU?
I don't think that's right. I think certainly there are nurses who have had to be taken off the front line. I think I've said before that we have the biggest health staff in the country by a long shot. There's about 140,000 people that make up our health system, And part of the issue is certainly, or that's brought the pressure on the actual hospitals, is that some of the nurses who would normally work in various parts of the hospitals have had to go into doing the preventative work, and that is vaccinating in our various vaccine centres. And so you'd expect that sort of pressure, but I certainly haven't heard of any current ICU nurses leaving.
The Nurses Union has mentioned some of their staff have gone there.
Well, let me finish, please. There may be a small number, and certainly what I would say to the Nurses and Midwives Association is, instead of giving the negativity, how about you get out and back everybody and be a bit more positive, because I think that's not helpful. And I've noticed that the HSU, Health Services Union, has been extremely supportive and positive, and I want to acknowledge them for being out there and making sure the community know, and the health community know, that we're all in this together. But I have noticed that one or two of the other unions are actually out being negative. That's not helpful. Ursula.
Could we ask you, the Premier mentioned yesterday the modelling which will show that October is the worst month for our ICUs. Can you tell the people what is the number of cases that we're predicting in the community in general and in ICU? What's the worst case scenario that we could see in October?
Look, I've talked about this many times. That the modelling that we see, there's a whole range of modelling, and of course the Doherty Institute has put out its publicly what it is estimating is going to happen over the next few months. What the actual figures are vary depending on the inputs. The most important input, of course, is how many people are going to get vaccinated. So the short answer is, as I said earlier, get out and get vaccinated. Don't be so selfish or self-entitled as to think you're different from the rest of us. You're not. Go and get vaccinated and give the entire community, particularly frontline medical staff, a fair go. Ashley.
So just in terms of talking about capacity across the network as we head to October, which is foreshadowed that there'll be a lot. The AMA has come out today and said, yes, you have all the equipment and there's the capacity, but there won't be enough staff to work. Are you confident?
Sorry, is that the New South Wales AMA?
Yes, the New South Wales.
Danielle McMullen?
Yes.
Really?
Yes.
Well, look, thank you, Danielle, for those comments, but she's not directly involved in what work is going on inside our health system. She's a general practitioner, and the information that the Premier and I are getting from our health system is we have got appropriate staffing levels, but of course it's under pressure, and it will be. We're in a pandemic.
Premier. Can we just check in with you on...
September 17 deadline, still thousands of aged care workers who haven't got their vaccination. How confident are you that they will, and is this something that should have been done sooner?
Look, aged care is obviously the responsibility of the federal government, and the federal government asked each of the states and territories to use their own legislation rather than the Federal Biosecurity Act to ensure that staff in aged care facilities were vaccinated by the middle of September. I'm not at all confident that all those staff will be vaccinated, and that's a matter for the federal government to discuss with each of the states and territories as we get closer to that situation. But what I would say to all of the staff in aged care facilities, and we value what you do looking after our senior citizens, is you have an obligation to go and get vaccinated quickly. There is an expectation when we see our older folk go into an aged care facility, if it's my mum, my dad, your dad, we expect there to be people there who've been vaccinated and are looking after them. So I understand the federal government's desire to get it done, but it's certainly not at the rate that I would like to see it done. Can I just finish? Can I finish, please? And so I would say to the federal government on that issue that we need to actually put in place an appropriate system. It shouldn't be up to each state and territory to determine what will happen in the middle of September if, in fact, they don't have all those aged care facilities vaccinated. That's a discussion that has to take place with the federal government.
You didn't really answer Ursula's question. In relation to the modelling which predicts October will be...
I've answered the question as far as I've answered.
You said it depends on inputs. On the inputs, what's the figure?
In regards to the vaccine rollout in the high-risk LGAs, some residents have been told to wait 8 weeks between their first and second Pfizer dose. The national standard is between 3 and 6 weeks. How far will this push back your modelling to get to 70 and 80% vaccinated? And are those residents in those suburbs now at higher risk?
Obviously, the percentage or the vaccination rate in relation to second doses is based on the health advice. The best health advice we have received from Dr. Chant and the public health team is that we need as many people as possible to get that first dose in their arms. Once they have the first dose, we know they have a level of protection. And that is why we followed the health advice, and Dr. Chant and the public health team have been very clear about that. The timing between the doses is based on what is going to give maximum number of people maximum coverage in the shortest possible of time. We are still estimating that we will hit the 70% double dose figure somewhere in October. Previously, it was the end of October. If we keep the current rates of vaccination going, we could hit that in mid-October. So my message very strongly during September will be to everybody, get ready. If you're a business, make sure your employees are vaccinated. If you're a citizen, make sure yourself and your family and loved ones are vaccinated, and your friends, because that is our ticket to freedom. Vaccination is key for us moving forward in terms of getting back to normal. And normal under COVID will still mean you have QR codes, still mean you need to check in, still mean you have to maintain social distancing, wear a mask in certain settings, but we will be much freer than what we are today, absolutely. So at this stage, the rate of vaccination that we're managing to do in New South Wales will hit the 70% double dose somewhere in October. But what Dr. Chant and I are now keen to see is that first dose go up to 80% very quickly, because that will then give us an indication as to when we'll hit 80% double dose.
You did mention that international travel, and you expect it to be by December, I think you said. Is that a commitment that New South Wales will allow international travel to, like, we'll be able to leave and they will be able to come here as soon as we hit 80%?
Well, that's why we've actually said on a number of occasions, as has the Prime Minister and the Federal Treasurer, Frydenberg, that it's really important for all of us as states to move forward together. So every state is going to have to deal with the confronting fact that we have to live with Delta. And as the Federal Treasurer, I think, said a few days ago, it would be disappointing if New South Wales and Victorian residents were able to go overseas before they were able to go interstate. Now, that is something we don't want to see. We obviously want to see Australians reunited with their families at Christmas time. I mean, my absolute goal and dream is to have every Australian be home for Christmas, whether it's Aussies within Australia visiting loved ones or whether it's Aussies overseas coming back home. Once we hit that 80% double dose vaccination, New South Wales will continue what we've done during the entire pandemic, is do more than our fair share of reuniting families, of having a compassionate approach, accepting we're all Australians, and that is first and foremost our absolute goal. Oh, you've already asked the question. I'll get some.
Just follow up, because
don't scream at me though. Yeah.
Can I please follow up, Premier? At 80%, the WA Premier has been very clear that he is not going to open up internationally. So will New South Wales go it alone to open internationally if the rest of the country is not open internationally?
We will follow what is in the national plan that every single Premier has signed up to. Now, I hope Premiers don't back away from that plan. But National Cabinet signed off on what 80% double dose vaccination would look like, and that involves consideration of international travel, of welcoming more Aussies home, of also, once we hit 70% double dose, we'll be thinking about, if not beforehand, how we treat people in quarantine when they're coming home. If you have fully vaccinated Aussies coming home, do you expect them to be in a hotel for 2 weeks in quarantine? Can we look after them at home as we do now, all the COVID cases? So there are lots of positive things to look forward to, and that will all depend on our double dose vaccination. But what it also depends, and I don't want to take away from this point, is that what Nurse Michelle Dowd highlighted today is all of this depends on keeping pressure off our hospital system, our intensive care system, and that means getting vaccinated. So getting vaccinated allows our hospital system to cope, but it also makes sure that we have all these positive things to look forward to. Now, the national plan, if not at 80% double dose, then when will we have international travel? 80% double dose of the adult population, and by then I'm assuming that a certain cohort of 12 to 15-year-olds would be vaccinated as well. If not at 80% double dose vaccination, then when? I think there's only one jurisdiction on the planet that's managed to keep 80% double dose vaccination outside of Australia. I'm confident New South Wales can do that. I'm confident Australia can do that. But what it's really important is for us to move forward together.
Premier, Queensland's Treasurer said this morning that LNP governments around the country are chock full of crazies and that they're not going to open up if they've got too high case numbers, even if they hit the target. Same positions in WA. So, further date question, are you going to open international borders if domestic borders are closed?
Well, that is a conversation we'll have with the Prime Minister, with our National Cabinet colleagues, but I don't understand why some premiers are walking away from the plan that all of us signed up to. National Cabinet signed off. Well, what the Doherty Institute also provides information about is, irrespective of your case numbers, what you do with your public health measures at 70% and 80% is also contingent on that. So what 70% looks like in New South Wales double dose might be different to what 70% in WA looks like double dose. But it means we'll still be much freer. And the key issue for us is, remember, we are the largest population, the highest density, the highest diversity. What matters is having our hospital system not overwhelmed. And that's the delicate balance we need to consider moving forward. So every day, and this is literal, every day what keeps me awake at night is making sure that our wonderful staff, like Michelle, aren't overwhelmed in their jobs and are able to take care of everybody as they need to. And that is the figure. That's why when I say the most important figure for us to look at is the number of people in hospital and the number of people vaccinated. That is it. Because come 70%, when the vast majority of people are vaccinated, case numbers, of course, will matter, but they'll matter less when you've got higher rates of vaccination, because that will tell you to what extent the hospital system can cope in a reasonable way with all the cases. So I'm having this conversation now because our citizens are entitled to have direct and transparent advice, as I receive it, so that we can all start thinking about COVID in a different way once we get to 70% double dose, because the way that we deal with COVID cases, the way that we deal with quarantine, the way that we count things will be completely different once you have those high rates of vaccination. And that's why it's really important, as confronting as it's been. And I'm hoping in a few months' time, when people will look back, they'll say, well, at least in New South Wales, they told it like it was. They told us exactly what to expect. And also, the conversation we're having now will prepare us for when we get those higher rates of vaccination.
You say you want to tell it like it is and give people every bit of information they need. But we still don't know what the modelling and the health advice is that you say that tells you that October is going to be our worst month. So what is the health advice and what is the worst case scenario for hospital admissions that you have been given for October with things proceeding as they are?
Well, obviously, as you increase the rate of vaccination, it reduces the likelihood of people getting COVID and being severely ill of COVID. So we know now we've gone through a very intensive period of vaccination in those local government areas of concern in particular. So once the effect of that vaccination is apparent, so obviously once you get your jab, it takes 2 to 3 weeks for that to have effect, we will see a slowing down of the spread. And so when you assume the number of cases that keep going up every week, and that's expected with the Delta strain, there is a lag between when people get sick and when they're likely to need intensive care. And based on that, the best advice I have, and as the modelling changes every day, and it would be inappropriate to say, well, today it's this and tomorrow it's that. We don't know the answer as to what it will be in October, but what we do know is that in all likelihood, when Michelle and her colleagues will be under the greatest pressure will be in October, because then you have the accumulation of cases with an unvaccinated population. But once you get those higher rates of vaccination, the rate of hospitalisation declines. The rate of people in intensive care declines. If we have anything concrete, of course we'd provide that. But what the public needs to know the most is this, is that for the last 18 months, our hospital system has been preparing for this. Our staff have been getting trained. We have the best intensivists, the best ICU specialists, the best hospital experts giving us advice. And what we also know is that we have room to move in terms of capacity. But for example, we've had intensivists tell us now that the rate of hospitalisation, which is a figure when it's updated we'll be happy to release, the most recent figure I had for rate of hospitalisation was 5.5% in terms of cases converting into hospitalisation. But as the rate of vaccination goes up, that is the best indication. So once we get updates on that figure, of course we'll convey that. But you can already say from the rate of hospitalisation in intensive care that really it's the unvaccinated that are most vulnerable, the unvaccinated who are unfortunately the patients that are most likely to be there. And if we have anything concrete, of course we'll pass that on.
Almost 70% of people do not have 2 doses. So most people are unvaccinated. You're giving us concrete projections of when we'll get to 70% first dose, 70% double dose, 80% first dose, 80% double dose. For 3 days we've been talking about October being the worst month for ICU. What does that look like? You're giving us concrete examples of what the good news is, but not the bad news. What does October look like in ICU according to the modelling that you have and you have been talking?
What October looks like depends on what we do in September. And we need to be very upfront about that. I'm being asked to provide numbers. I'm not going to pluck numbers out of the air. When the experts say that there's a number of possibilities that could result, right, it's not appropriate to pluck numbers out of the air because I would be doing everybody a disservice. But what I can do is tell you what the rate of hospitalisation is, that the fact is that if you're double dose vaccinated, in all likelihood you won't succumb to severe illness unless you have underlying conditions. So these are the important information we need to give to our community. But to provide, it's not my job to pluck figures out of air, and I would never do that.
There were five men yesterday who were found in Leppington playing cards, COVID positive, outside. They've got form, given a fine. Why would they not be taken to, for instance, health, hotel quarantine or even custody? They've already shown they're willing to go outside with COVID.
Well, I think, and this is the issue about what October and September look like, it depends on people respecting each other and doing the right thing.
Why wouldn't we take harder action as a society?
Well, as Dr. Chant has said, she has the ability to do that in certain circumstances. It's a power that I know isn't often used, but it's there and available. And health experts have often relied on those powers. But know this, that we've worked for this for a long time. Is the system stretched? Is it going to be stretched? Yes. But are we prepared? Have we trained up our staff? And of course, those hospitals in those hotspots are the ones under most pressure, which Nurse Michelle comes from in Liverpool. So we know the challenges that we face, but we know the best way to get through those challenges is get vaccinated. But I also want all of us to keep things into perspective. The lockdown, as painful as it's been, has demonstrated that we have managed to keep case numbers relatively, I know this is confronting, lower than what would have happened otherwise. The rate of increase of cases has been consistent. It's not been exponential, and that's the way we want to keep it. And the best way we can do that is through vaccination. But I also want people to feel that once we get to those higher rates of vaccination, we will be thinking about everything differently. How we track and trace, how we quarantine, how we look at what success looks like. What success looks like is keeping our intensive care patients low and keeping vaccination rates high, because that will give us the greater level of freedom.
Premier, yesterday Dr. Chan said that COVID is affecting Indigenous communities disproportionately. Are you comfortable opening up at 70 and 80% if vaccination rates in vulnerable communities like Aboriginal communities aren't near that 70%?
Well, that's why, the two reasons why. Firstly, we have a very intensive vaccination program for communities that are especially vulnerable. That is why we've targeted unapologetically younger people, workforces in southwestern and western Sydney, why we asked for extra doses in far western New South Wales to support our Indigenous communities. Can you just let me make this important point? I just want to finish this important point. And that is why there is no reason why anybody over a certain age should not have got the vaccine. I've had the AstraZeneca. I'm 50 years old. I've had the AstraZeneca. Nobody of a certain age should even have any hesitancy with the AstraZeneca. And it's really important to know that when we open up, those that are unvaccinated won't be allowed to do other things because they will be exposed. That is why at 70% double dose, the freedoms will extend to people that are fully vaccinated. We cannot afford to have the unvaccinated exposed to venues, and we can't afford to have the unvaccinated susceptible to disease, to get disease. And that's why we're urging everybody, giving people plenty of notice to say, if you want to participate in the freedoms that come with 70%, that come with 80%, please get vaccinated. But that is why, whether it's our Indigenous communities, whether it's our older population, those with immuno issues or other comorbidities, that is why we have a targeted vaccination program. The federal government clearly does, and we've picked up some of the stuff that should have perhaps happened a bit earlier. But having said that, this is why we have the strategy we have. It's really important. That is why it's 70% double dose. I don't want people who've chosen to be unvaccinated complain when we get to 70% double dose. I'll get around to everybody, please.
Follow up. Are you prepared, though, to go it alone? Is New South Wales prepared to go it alone, though, even though it could mean being locked out from the rest of the country for a significant period of time? Because WA and Queensland have already said that they will not open the border in these circumstances.
Well, I think what is really important to focus on is the fact that every single Premier and Chief Minister signed up to the National Plan. New South Wales intends to stick to that plan. And we hope that every other state will stick to that plan. I can't account for what other state premiers choose to do or not to do, but I would be very disappointed if anybody walked away from what is a plan we've all signed up to. This is when we really need to think of ourselves not just as citizens of a state, but citizens of Australia, and accept that we have friends and relatives, work colleagues that live in different states, that we have Australians wanting to come home, and if not at 80% double dose, then when? And that is why it's really, really important for all of us to move together in a coordinated way, but also to confront what New South Wales had to confront before any other state. And that is that a lockdown doesn't necessarily mean you get lower cases, because the Delta strain is different. And what we also have to accept is that every state in Australia needs to learn to live with COVID. We can't pretend anymore that we can have 0 cases whilst Delta is on the planet. And I just urge all of our colleagues across the nation to work towards the national plan, because that is in the best interests of our citizens across the nation, and to make sure we plan as much as we can to support our hospital network during this difficult time.
Premier, just in relation to Indigenous communities, sorry, just a question for NITV, just a few, if I can, please.
I'm sorry?
Just a couple of questions for NITV, just in relation to Indigenous communities, as you were talking about before. We're just following that story from Wilcannia, where the Narromine Aboriginal Health Service in Broken Hill sent the federal government a letter last March predicting a catastrophe for that area, and they said that no help was received. They sent another letter to Scott Morrison last week, and they said they CC'd you into that letter, and they're basically crying out for help because they're saying that communities there are so impoverished that quarantining facilities are desperately required, and assistance to help people to quarantine at home. Now, that's one of the areas that's got the highest infection rates at the moment. What's the Premier doing in response to that letter? What are you doing there on the ground now? And what's being done?
Right, Minister Hazzard might be in a better position to answer that question. No, I'll be back, don't worry.
Thanks very much for that question. Look, I have been obviously talking to various health officials in a number of the regional towns that have a substantial number of Aboriginal people in them. And certainly Wilcannia is a relatively small community. I visited Wilcannia many times, and it's very challenging because there is, I think there's one motel from memory in Wilcannia, and finding alternative accommodation has been very challenging. So as late as yesterday, I was communicating with the Planning Minister to try and get approvals to have additional accommodation available on a portable basis up in Wilcannia to allow separation of people who are positive. It's very challenging, and it certainly would have been preferable if the Indigenous community, the Aboriginal people across New South Wales, had been vaccinated earlier, no question. I know, talking to Christine, who runs the AMS at Walgett, there have been some challenges about, again, a hesitancy of one particular vaccine, and that's proved very challenging. And Murramah, who of course is located at Broken Hill, has been doing lots of good work. I've done lots of work with them, and they have been obviously expressing concerns for a while with the federal government. Look, it's disappointing, it's challenging, and today I think we can either look back and say what we should have done, and we can spend our energy on that, or we can spend our energy on trying to make sure that it gets fixed as best as possible.
And sorry, Minister.
As best as possible for the Indigenous community, particularly in northwestern New South Wales, but more broadly And I can say at this stage that there is a huge amount of effort going in from the federal government, from the Royal Flying Doctor Service, from the Far Western Local Health District and the Western Local Health District. The biggest number of cases, of course, at the moment is in Dubbo, and a lot of the folks who live in that, particularly the western part of Dubbo, around the old Gordon Estate site, that area, a lot of those folks have relatives and family members up right out to Broken Hill, and there's been a lot of movement back and forth that has unfortunately spread that virus. I can tell you there's a lot of work going on at the moment, and certainly to all the Aboriginal people across New South Wales, I just say from the New South Wales government's point of view, and I believe the federal government and everybody else who's trying on the ground to do the work, we're trying to get to you, we're trying to get the vaccines to you. Please take the opportunity to get it, and if you get sick, hopefully we'll be able to make sure that we've got adequate care for you. Certainly there have been a number of patients that have been transferred to our major hospitals, but not many. So at this stage, it seems to be being managed fairly well. Sorry.
And Minister, just a follow-up question to that.
Sorry, I'll just finish on the Aboriginal questions.
Yeah, please. Thank you. Thank you, Minister. We've heard reports that there are actually pop-up emergency accommodation and isolation venues, or what look to be such, in the Broken Hill region. Can you detail those efforts? Are they up and running at the moment? What's happening?
As I said, yesterday I had communications with the Planning Minister getting approvals for those issues, and it's a combined effort of the federal government and state government. But I can't tell you specifically whether they're there yet, but we'll certainly find out for you for a bit later. Yeah.
Minister, just one more last question on Indigenous issues. So, Minister, you mentioned it's a bit of a shame that the communities weren't vaccinated earlier. Who bears responsibility for that? Is that the federal government or the state government? We've only got about 11% of people, Indigenous people in the West, vaccinated. That's a pretty low percentage compared to the rest of the state, Greater Sydney. Who bears responsibility for that outcome?
Look, I think Aboriginal people obviously primarily are the responsibility of the federal government, but I think, again, laying blame is not really what we should be doing at the moment. What we should be doing is bringing all of our energies, state and federal, to bear to try and make sure that everybody who wants to be vaccinated is vaccinated, and that everybody who gets sick is well cared for. And certainly the Royal Flying Doctor Service, the state health system, and with federal support, I wrote to Minister Hunt about 3 Wednesdays ago, I think, and pointed out that we needed help in those particular areas. And I think it was about a week or so after that quite a number of ADF personnel arrived. So there's a big effort going on to try and fix it. And all I'd say is it is disappointing and it's concerning, but I think now let's look forward and not backwards.
Personally. There are protests popping up all over the state. We've seen them outside Parliament, they're in Byron Bay, they're outside councils, they're outside police stations. Are you worried that you're losing the messaging? Are you losing the people on this?
I think the fact that our vaccination rates in New South Wales are going through the roof indicates that the bulk of the community are very, very supportive and they understand the need to get vaccinated and move forward. Sorry, James. You will always have a certain group who unfortunately are spending more time on social media and listening to people with crackpot ideas than you will have perhaps reading the scientific journals and talking to the doctors. My strong advice would be to talk to your doctor about what you should be doing to try and stop this virus. I mean, when you think about it, in a few months' time, when we've got a very high level of the community, possibly 80% that'll be double vaccinated, there'll be a relatively small percentage of people who will have no vaccinations, and yet they'll still expect to come into our public health system, paid for by the taxpayers of New South Wales, and putting staff like Michelle at risk. You've got to ask about whether that's really a fair way of thinking, a just way of thinking. Why should people have that luxury not to be vaccinated and then expect to put our frontline health staff at risk by coming in and getting looked after in our public hospitals and expecting taxpayers to pick up the charge? I think it's time that people just got real about that. Sorry, James.
I've got some questions for Dr. Chant as well.
Yes, Dr. Chant.
And the Premier too. But Minister, just for you, quickly, how many authorised workers do you think or do you expect will not take up a vaccination dose before they are?
I don't know, James. I don't know the answer to that. But what I would say is that the take-up has been quite incredible, and I want to thank all the authorised workers who have got vaccinated and are now back doing the incredible work they do right across our city and indeed across our state.
Supply chains, if a lot of people.
Sorry, James, you're just very quiet.
It could have an impact on supply chains if a lot of essential workers don't get
But
vaccinated?
I think they are. They're getting vaccinated very quickly, and I think they're doing well, and I want to thank them for doing that. I want to thank all the community who are actually being vaccinated.
Dr. Chant, Dr. Chant, Dr.
Talking
Chant.
about Wilcannia and the advice you received from Murray Marr, but it's important to note that they said that they actually contacted the New South Wales government, specifically the Premier, last year warning about Wilcannia. And they're critical that you guys are kind of presenting the situation as more rosy than it actually is. They're calling it chaotic there now. So why wasn't more done before the current outbreak for places like Wilcannia?
As I said, the issue across all of the Aboriginal community is that the federal government had certain responsibilities at the outset, and they had responsibilities for aged care, for people with disabilities and the staff that work in those facilities, and for Aboriginal people. And they were in their particular program, and the fact that that has not been achieved is obviously disappointing. But New South Wales Health, as have each of the other states and territory health, public health units, that is state health units, have stepped up to try and assist, and will continue to do that. At a personal level, I have many friends who are Aboriginal in the northwest of New South Wales, and I'm quite frustrated. As I said, I talk to people up there quite regularly, and I'm frustrated about it. But there's not much. Sorry, just seriously, you don't all have to yell. We're not rushing out, and I want to see that done as quickly as possible. Ashley.
Minister, isn't that the point you acknowledge that there has been failures with the vaccine rollout to Indigenous Australians, but New South Wales is pressing ahead with opening up at 70 and 80%. And those Aboriginal communities, especially in far western New South Wales, they're only at about 20% vaccination rate. So pushing ahead, aren't you leaving these then vulnerable communities exposed if you hit this 70 and 80%?
Actually, I think what the Premier said was we're aiming to try and get 70 to 80% right across our state. And let's deal with today's issues rather than hypothecating or hypothesising what might happen in 2 months. But we're aiming to get all of our state, all of our communities up to 70 or 80%. Alex. Oh, yeah.
Now, they haven't been locked away. They're back in the house. We know they've done the wrong thing a number of times and possibly could do it again. Still no one find out that the Berejiklian party. Why persist with the softly approach when it comes to people who are doing the wrong thing?
I think that it's fair to say the police have taken a very tough stance, and so has the New South Wales government, on those that we can take that tough stance on. And there are many. Many have received very substantial fines, and I just reiterate that fines are up to $5,000. You can end up $5,000 poorer by not complying with the health orders, and you may end up going to court and doing 6 months in prison and or having an $11,000 fine. But of course the priority, and you know this because you've been in these press conferences for 20 months, and I've explained it probably 150 times, is that the health staff take the view that when they're trying to track and trace contacts, the most important aspect for keeping our broader community safe is that our health staff be able to elicit that information from each of those people first and foremost. Police action can be taken at an appropriate time, but that's not something for health staff to actually be preoccupied with. It's about keeping our community safe through getting the information that's necessary. I think we're going to finish fairly soon, guys, because it's almost the end.
We understand that a woman travelled from Parkes after getting a test and then it came back positive on arrival.
I'll have to look into that. I haven't been briefed about that, but I certainly will. And just to reassure the fact that we're very committed to ensuring there's very high levels of coverage in our Aboriginal communities. Just to let you know, there are joint teams that are going to all of the sites around the centre of Dubbo, Wilcannia, Broken Hill, but all of the small communities outside in a cyclical way, and we're hoping to go through again and do ensure that we've got those 2 doses of the Pfizer vaccine into those Aboriginal communities as soon as possible. So we are very committed to ensuring that the Aboriginal coverage actually exceeds the non-Aboriginal coverage, and that's what the pattern is for childhood vaccinations. In some ways, Aboriginal people have embraced vaccination more than non-Aboriginal people, and that's certainly our intent.
Dr. Chant, the EPI report that week of ending 14th of August is out. Only 95 cases in that week, 14th of August, were fully vaccinated. The vast majority had no vaccine at all. Do you expect that trend to continue, and when would you expect that trend to shift to having more people catching the virus who are vaccinated, considering that's one of the Premier's metrics that she wants us to look at?
So I would hope that it would increase. can I say unashamedly, we have prioritised the people of southwestern Sydney and Western Sydney for vaccines. Whilst the risk is everywhere, clearly people in those areas of Liverpool, Campbelltown, Cumberland local government areas, Canterbury, Bankstown have been particularly impacted. And we have done all we can to prioritise it. And I know there was an earlier question around the 530,000 vaccine doses. So modelling suggested getting those doses into arms first will have the greatest impact. And obviously because of supply constraints, we had to push out the second dose to a time point when the Commonwealth had projected that they would have insufficient vaccine. If that changes, clearly we can move appointments forward, but that's actually currently consistent with the advice of extending the period from ATAGI, and we've just pushed it back to that notional 8-week period, consistent with the clinical trials that show that that's a very effective level. But obviously we're keen for people to get vaccinated as soon as possible, but it is an issue about Pfizer supply.
And there's a 10% drop in the number of people being contacted, interviewed by health within 1 day of their diagnosis, at 70% in the week of August 14. Has that deteriorated further, and if so, how much?
Look, we are, the case numbers are really challenging for us to manage. I'm not going to walk away from that. But I'm really pleased to say that we've put in a range of things, and I just want to thank the community for responding. So, in terms of the process, we send a text message. So the pathology... Sorry? Could I just talk about the process, and we'll talk about the stresses and what we've done. So what we're starting with is a text message that obviously they'll get a message from the private pathology provider or our pathology indicating their result. We'll then send them a text message which gives them information as well as a questionnaire, and that allows us to prioritise cases, so those higher risk cases that might be aged care workers, disability workers, and I appreciate the community responding. We're also then having police who are doing welfare checks. And so we provide a list every day of the cases, and police do visits for them, and they actually hand them a letter and some additional information. They've also got translated materials that can be handed there, again as a stopgap, because we know isolating the case, isolating the person with COVID and their family, because their family is likely to have already been infected at that point in time, is critical. We then follow up with a more detailed interview which elicits other high-risk settings, and as I said, we're triaging and prioritising. I cannot stress enough, our contact tracers are stretched, but that is why we are also putting these other range of risk mitigations in place. In addition, the clinical care teams in our districts are which is in our hospital-based system, is actually reaching out to individuals as well. And we are also responding to a large number of welfare needs and developing systems to respond to that. So, yes, it is going to be challenging for us to keep those times up. We are surging, but we're trying to make sure we focus on those very key public health interventions of making sure the case is isolated and their family, and then trying to do other critical workplaces. But we have to prioritise with these case numbers.
Just one more for Dr. Chant, and then one for
I'm sorry.
One more for you for me. I'm going to ask a question now.
Okay, last question. No, I'm sorry, everyone's had a chance. You haven't. Yeah.
Are you looking at cutting international arrivals from mid-September, and where are we at with home quarantine?
In relation to quarantine, we are looking at what models will work best moving forward when we hit 70% and 80% double dose. At the moment, we have thousands of staff looking after our international returning Aussies, even though there's only 4 cases, I think, overnight in hotel quarantine versus the number in the community. So that obviously needs readjustment. And I echo the calls made by the Prime Minister today that once you get to those higher rates of vaccination, when you have Aussies coming home that are fully vaccinated, I think home quarantine is a logical place for them to be quarantined, as opposed to having so many staff involved in that. Would rather have our staff working in our IC units or giving people vaccination. So we are looking at all those options, but that's why, even to Dr. Chant's comments now, and I'll finish on this point today, we'll be back tomorrow, so you can ask all hold on, you're asking all your questions again. But in terms of international arrivals, I think we've been offered to go down to half what we have now, which is what we've accepted for the next month, so we'll be doing half of our current international arrivals, but obviously we're hoping to pick that back up once we get to those higher rates of vaccination. We'll be back tomorrow and the day after that. You can ask us all your questions. Excuse excuse me, James, you've asked about 20 questions today. This is, as I said, in relation to quarantine arrangements, in relation to how we track and trace. Once you get those high rates of vaccination, all of the systems that we've been used to for the last 18 months will change. Not only is Delta different, but vaccinating the population at higher rates is different as well. So I just say to all the community, we will be having these ongoing conversations every day to explain the changes we're making, but it's transitioning, and the Doe report talks about this, it's transitioning from an unvaccinated population to a vaccinated population and what living with COVID looks like. But in the meantime, please stay safe, please stay at home unless you have to leave, and please get vaccinated. We'll be back tomorrow. Thank you.